So today we are going to talk about something very exciting. We're going to talk about colon cancer. And I want you to go ahead and introduce yourself. Tell us who you are, who you're with, and a little bit of background information, and then we'll get started.
Absolutely. So my name is Christopher Dwyer. I'm with Texas Colorectal Specialists, which is recently acquired by Texas Oncology, PA.
Okay.
I practice mainly in Mansfield and South Arlington. I went to medical school in San Antonio, Texas. I grew up in Dallas. And after medical school, trained in Pittsburgh and then Indiana for colorectal fellowship. So I've kind of been all over outside of Texas training, and then wanted to come back home, and Mansfield and Arlington seemed like a great fit for me.
Okay.
So yeah, that's where I've been.
Very good. And so how long have you been here then?
So 4 years
Okay.
here practicing. I'm a board certified colon and rectal surgeon,
Okay.
which we get to by way of being a general surgeon as well.
Okay.
Yeah.
Okay.
So,
Excellent.
yeah.
So we're going to talk about, I guess it's March's
Colon Cancer Awareness Month. Yeah.
Yes. And so we all kind of know what colon cancer is, but if you could maybe start by telling us, how does it occur? I mean, how do you get that?
Sure, absolutely. And I did want to take one moment and say thank you for doing this.
Oh, yeah.
Last year, March kind of got a huge stain on it when we shut down the system for COVID, obviously. So this is a nice comeback for this year. So I appreciate you doing that. Obviously, colon cancer is not something the average Joe may think about in their daily life. However, it is the second most common cancer in both men and women now.
Wow.
Lung being the most common for both of us, men and women, and then prostate and breast obviously being up there as well.
Okay.
And so colon cancer starts where the inner lining of the colon, which is called the mucosa, has glands in it. That's what makes mucus to help us go. Sorry for the
It's all right.
for the graphic
It is what
detail.
it is, yeah.
And so those glands, one of them turns on and replicates itself, and then it can't stop replicating itself, and then it becomes something that most people are probably familiar with, which is a polyp.
Okay.
A polyp is essentially an early precancer, and left unchecked, in other words, left not having had a colonoscopy where we remove that polyp, over about a 10-year span, it can become a cancer.
Wow.
And it grows and it grows and it stays local in the colon until it gets large enough to where it can travel to other sites, like lymph nodes or your liver, other organs. And so the goal with Colon Cancer Awareness Month is to make sure that everybody over the age of 45 goes and gets their screening colonoscopy. And the reason we call it screening is because there's nothing wrong with you.
Right.
So you should be able to go. You don't need to say, well, I don't have any problems. I don't need my screening colonoscopy. It's like saying, well, I don't have any problems. I don't feel a lump in my breast. I don't need my mammogram. And mammograms save lives just like colonoscopies save lives.
Right. So what causes, because not everybody gets these polyps, right?
So good question. So about 50% of people that we do screening colonoscopies for have a polyp that's precancerous. So at age 45, and for some reason it tends towards men, so it's actually about 30% of women and probably more like 55-60% of men. They will have a polyp, and if you don't remove that polyp, it will eventually become a cancer. So it's a very important thing to do as part of your health maintenance. Now the good news is, if you're one of the 50% that doesn't have a polyp, unlike mammograms that are every year, colonoscopy is every 10 years.
Right.
Right.
Yes.
So, exactly.
I'm hoping that the next time I have to have one done, because I've done one, that there will be a machine that you just walk through.
Unfortunately, due to the physics and the way our body works,
Hey,
there's
technology though.
You could talk about other screening options, right? So people ask about Cologuard nowadays, and Cologuard's a great test. It's fairly accurate. It's great for folks who will absolutely never get a colonoscopy.
Okay.
Right, because then if it becomes positive, then they have a little bit more motivation to go get their colonoscopy.
Right.
The problem with Cologuard is that it needs to be done every 3 years. So it's a test you have to do more often. And also, if it is positive, there's about a 20% false positive rate.
Okay.
So what that means is they're telling you you have the disease when you don't.
Mm-hmm.
So you need to go get your colonoscopy, and then now your colonoscopy is no longer screening, i.e. covered by your insurance company. It is a diagnostic colonoscopy, i.e. It goes towards your deductible. So you end up paying for a test that you may not even need.
Okay.
So at the end of the day, it's probably best just to go get
Just
your
to go
screening
do
colonoscopy.
Yeah, suck it up. Go do it.
Or suck it down.
Oh
so you
yeah,
gotta
exactly.
extreme as much.
That's true.
Exactly.
So how much is it mainly age or is it diet?
So as far as developing colon cancer,
Yeah.
so a couple things. We think that the increase in younger folks getting colon cancer
Mm-hmm.
is probably related to the environment,
Okay.
not hereditary, right? Now, hereditary colon cancer is associated with younger folks getting colon cancer, right?
Mhm.
But hereditary colon cancer is only about 20 to 25% of all colon cancers.
Okay.
Okay, so the other 75% is probably related to environmental factors, processed foods, the air we breathe,
Mm.
obviously anything you put in your body, whether it's medicines or toxins, things like that.
Everything. Yeah.
Sure. So I think that ultimately it's probably mostly environmental, but
Mhm.
partly hereditary as far as developing the colon cancer.
Well, is it to what degree is it preventable?
So your average colon cancer
Mhm.
is, we would argue, is almost 100% preventable if you do your screening colonoscopies, right? So about 30% of all people with colon cancer had 0 symptoms. So you ask them, like, well, what are the symptoms of colon cancer, right? So obviously abdominal pain,
Mm-hmm.
a change in your bowel habits. You usually go every day,
Mm-hmm.
but now you're going every 3rd day. A change in your bowel caliber, right?
Mhm.
So it used to be a nice big fluffy poop, right? And now it's something that's really narrow and looks like a pencil.
Mm-hmm.
You're maybe late 30s, early 40s, and you've never had hemorrhoids before, and all of a sudden you have rectal bleeding,
Right.
right? So those are the things to look for. But only about 70% of people with colon cancer have a symptom like that. So the other 30% need to do their screening starting again at age 45,
Mm-hmm.
just to make sure. So
Okay.
yeah, I just saw a patient yesterday actually who's 46. He convinced his insurance company, who was not on board, to cover his screening till he was 50, and he had a mass in his right colon.
Really?
And he had no symptoms, no issues. Went to his gastroenterologist, did the colonoscopy, and sure enough, he's got a colon mass in the right colon.
Wow.
So it's kind of one of those things where colonoscopies do save lives.
So let's take it to the next level. You've got it and maybe didn't catch it soon enough. I mean, what are the, I know we all kind of know what happens, but tell us, kind of scare us into getting it done. Come on.
I'll get bad reviews online. So when you say you didn't catch it early enough, right?
Mhm.
So let's talk about staging of colon cancer
Okay.
real quick. So if we catch it on a screening colonoscopy, everyone knows usually there's 4 stages of colon cancer. Okay, just like every other cancer
Right.
stage 1, 2, 3, 4. Most cancers caught on screening are going to be stage 1 or 2, so early colon cancers, which is great news because as a surgeon, it's surgical cure.
Right.
Meaning you don't need chemotherapy if you have stage 1 or 2 colon cancer, which is great. So you're done. I get to follow you. We're friends for 5 years. Okay. If we get to the point where we do surgery, it maybe caught it a little late, as you say.
Mhm.
That probably means it traveled to the lymph nodes around the colon, which is something that we harvest at the time of surgery.
Mhm.
And at that point, you would need what's after surgery chemo.
Okay.
Okay. That's just a port. You get chemo every 2 weeks. It's usually for about 3 to 4 months. And then after that, we just follow you much more closely. Okay. Stage 1 and 2 have anywhere from an 80 to 90% 5-year survival rate, which means in 5 years, you have about a 90% chance of being alive.
Okay.
Okay. But those are just numbers. Everybody's different.
Right.
Stage 3 is probably more like 60,
Mhm.
but with chemo.
Okay.
Right. Now, stage 4 is when, as we talked about earlier, if the cancer goes from the colon to another organ.
Okay.
So your liver or your
So
lungs.
how do you say that?
Metastasized. Thank you.
Yes.
So if it's metastasized to other organs, that's a bad problem to have.
Okay.
And generally speaking, it used to be in the old days that you had about a 10% 5-year survival. With new drugs and the way our oncologists are treating this, the 5-year survival rate's up to about 20 to 25%, which is much better, about double what it used to be. But like I said, I really want to stress, these are individual statistics, right? They're not individual people.
Right.
So, yeah.
Now, aren't there times too that you take portions of the colon out?
Yes.
Or,
that's the surgery, right?
Okay.
So let's take the gentleman earlier that I mentioned earlier. So the colon's basically a big question mark in your abdomen. It goes through all 4 quadrants, right?
Right.
So you have a right colon, a transverse, a left colon, and then a little S-shaped sigmoid colon, and then the rectum, which everybody likes to talk about. The right side is over here. I know, right? The right side's over here. So you operate on a person's cancer based on the vascular distribution of the colon.
Okay.
So there's a right colic artery here. So we would take out the right portion of the colon. And then I would say the vast majority of people ask me this question. 100% of people ask me, am I going to need a bag for surgery, right? And the answer invariably, with some exceptions, is no, absolutely not. So probably 99% of the time that I operate, I end up not giving a bag for people. The only time you would need a bag is if there's a post-operative complication, which thankfully those are very rare.
Right.
So,
okay. Yeah. What else do we need to know?
So all the fun stuff that you like doing, eating good food, drinking, sitting on the couch with potato chips. They always say if it looks good, tastes good, it feels good, don't do it, right? So those are kind of like that's the cheeky way of saying how to avoid colon cancer in your future. The easiest way is to go get your screening colonoscopy at age 45.
Okay.
Or sooner if you have symptoms. Diet high in fiber, lots of water. So I tell people 64 ounces of water and 30 grams of fiber every day.
Every day.
And then just watch your body, make sure if you have any change in symptoms, go see a colorectal surgeon, make sure to explain everything to them.
Fiber. Is it important that the fiber be in food, or can you do fiber supplements to get to that 30 grams?
So supplements are not replacements. That's what I tell people, right? So psyllium husk can cause people's tummies to kind of bother. So psyllium husk is your Metamucil, biliverdin fiber, Citracel, that sort of stuff. So a lot of people say, I don't like taking the fiber because, so it's best to get it in your food if you can. But those, a tablespoon of Metamucil is 4 grams of fiber. Yeah. So you'll be having 10 tablespoons of that. So at the end of the day, maybe just throw in some avocados, which are great and high fiber.
Black beans.
Black beans are great too.
Yeah. Okay.
Yeah.
All right.
Yeah.
Anything else? How would we get a hold of you? Because we're all going to do this. We're going to get our screening.
Yes. So I practice at Medical City Arlington.
Okay.
Which is over there on Matlock Road. So we're in the professional building there. Okay. Just give my office a call. So 682-217-2102. Okay. Or look us up on the TCRsurgeons.com. So TexasColorectalSpecialist.com.
All right.
And then, give us a call, or if you see me on the street, I'd be happy to do your colonoscopy.
Wow.
So.
Right then.
Do not run into you in the parking lot.
No, probably not.
All right. Thank you so much. I appreciate it.
Thank you.
All
Have
right.
a wonderful day.
Yeah.
All right.
Okay.
I'll wash my hands now.